Namaste dosto. Today we will discuss about ICD11 coding. The International Classification of Diseases coding now version 11. Version 11 is a big departure from the previous versions of 10 and 9, 8, whatever. This greatest departure is because this 11 ICD11 coding has its primary focus is to make the disease classification computerized and make it compatible with the electronical medical record or EHR. That is the basic purpose. Here, it is nicely designed in such a way that the doctors can give a proper code for the disease. So in the previous versions, they were more explanatory, and whenever the codes were given, the most of the things were to be imagined. But here in the ICD11 coding, what has happened is they have made it such a way that the doctors can code it to the level, like they can even give the severity of the disease, they can even give the morphology, they can even give the etiology, they can even give the left or right, all sort of further post, what it is called as post coordination is also possible. The basic architecture is divided into the content model, which is basically a framework. Then comes a functional model and linearization. There are three major components. I'll just show some slides also how it behaves. Here, this is ICD11 coding. I think so you are able to see the screen. Next slide. See, in the previous, this one we had ICD10. It was more like a book, list of diseases. List of diseases were given, and the people were, or the person who was involved were supposed to search the list and give the code for the patient disease. But in ICD11, it is departure. There is a lot of changes there. Here, there is something like as content model, foundation model, and linearization. I'll come to this content model. Content model is nothing but just a framework. There's nothing, it is an empty framework where the rules are defined, but there's no actual value there. Only the rules are defined. Like it provides a structure for an entity, how it should be given, what are the properties are to be added for the disease. That part is declared in the content model. And the knowledge base is this foundation. And the linearization is application basically. So in the content, what we get is the framework, how the structure has to be kept for a given entity and what are its properties like left, right, etiology and all that things are to be defined. And actually the knowledge inside in the foundation, and linearization is application of it. So for example, a disease need not have a single hierarchy. Take for example asthma. Asthma can be a manifestation, it can come in a lower respiratory tract infection as well as in allergy also. Similarly, there are many diseases which can have a polyhierarchy. So this polyhierarchy is handled in foundation. But when it comes to linearization, the hierarchy is universal, single parent. This is the basic difference. So why this has been done like this? So for the clinician, when he applies the disease, he will be usually going in a single hierarchy. So that's the reason linearization is a single hierarchy, of course, which is derived from this single source of truth, that is foundation. This linearization is a single hierarchy, it is applied. Apart from the disease classification, this ICD11 also has got other things like functional disability and also for coding for interventions. That is also there. So that I will come to later. In basic, the simple model is there is a content model, there is a foundation model, there is also linearization model. Linearization, just remember, it is application. Foundation is, it is a knowledge base, and content model is nothing but it is structure or a definition how the things are to be kept. That's what is given in the content model. Now I'll go to the application of ICD11 coding, which we have implemented in our nice HMS, which is our HIMS. I'll just go inside nice HMS. Here, a login. If you want to write any diagnosis, for example, if you want to write a diagnosis, I will try to make one. This is already one patient diagnosis written. Now I'll just delete all of them. I'll try to make a new diagnosis. Now, for example, if you have got a disease, patient who has got ischemic heart disease, how we will diagnose it here? First, I will write IHD. Once IHD is written, you are able to see here the ischemic heart disease. Now I can further dig down here only, in that, or just I can go for further force coordination. In ischemic heart disease, I can force coordination, I can go down, and otherwise I just show ischemic heart disease can also have associated heart failure. If for example, if there was heart failure, I can put there. I can even ischemic heart. See, you are able to see here acute ischemic heart disease, chronic ischemic heart disease. Now we will put it as acute ischemic heart disease. In acute ischemic heart disease, further I can go down deep into the acute myocardial infarction. I will go down in that. Or angina pectoralis also is there. Otherwise, acute myocardial infarction also I can go down. In that I can go acute ST elevation, acute non-ST elevation. I can go for acute ST elevation. Now I chose acute ST elevation. Here, when I chose ST elevation, I can further choose the wall. This is a wall. Which wall? Anterior wall, anterolateral wall, or septal wall, whatever I want, I can add that also. And further, I can associate with coronary atherosclerosis. You can go on adding coronary atherosclerosis also can add. This is how we can further add the diagnosis in ischemic heart disease. If I want to add, apart from this, heart failure also, the patient has got heart failure here. Now he has got heart failure. Now heart failure, I will put it as left ventricular heart failure. I can put it as left ventricular heart failure with preserved ejection fraction, mid-range, reduced. I can go for mid-range or reduced ejection fraction. Then if it is associated with type 2 diabetes, I can add that also. Or type 2 diabetes also can add. I can even classify the severity of the illness. NYHA classification I can do. So this level of diagnosis we can do with the ischemic ICD11 coding. You can see the left ventricular heart failure, the reduced ejection fraction, marker limitation, type 2 diabetes. It is given complete diagnosis like this. So that's how you can add the diagnosis in ischemic heart disease. The way this skill you can dig down is not limited only to the heart. It is for across all the diseases. Now if I wanted to add hypertension, I will put HTN. I will put HTN here, go down here and select it. If I wanted to add associated anything more, for example, COPD is also there, means I can put associated COPD also. One more diseases, chronic obstructive pulmonary disease. I can see here COPD is there, chronic obstructive pulmonary disease, acute exacerbation. See, this is how you can add multiple diagnoses for your patient. This what is the ICD11 type coding. The ICD11 type of coding is much more useful and much more robust compared to the previous versions. And this is useful even for insurance claiming. So whenever you send your patients discharge summaries with ICD11 coding, the insurance processing also will become much more easier. So henceforth, I would suggest all of us should move to ICD11 rather than ICD10. If you got any other doubts or anything more to clarify, please do comment and in the comment, and also please subscribe to our channel. Thank you.